kind of take a step back and look back at how, you know, the whole world, what the whole world is looking at when they look at advancements in global health, and basically just try and understand what kind of indicators and what kind of things that we're looking at when we see what kind of progress we're making in the global health field. So we're going to talk a little bit, really quickly, about the Millennium Development Goals. I'm sure a lot of you guys know about them, but I'm just going to outline them really quick, and then we're just going to talk about some basic facts. So
this is where we ended last week. So these are just some good statistics for you guys to kind of wrap your mind around the problem. So 1.1 billion people live on less than $1 a day, and it's like, I don't know the exact number, but it's over twice that live on less than $2 a day. So, I mean, think about how much money you probably spent today between food, water, like if you bought clothes or whatever. I'm sure it's been more than that. 20,000 people died yesterday of extreme poverty. And of those 20,000 people, 92% are in South Asia, Sub-Saharan Africa, and East Asia or the Pacific. About 10,000 babies die every day in the world before they're 4 weeks old, largely from preventable deaths, stupid deaths, as Paul Farmer would call them. And over 340,000 women die a year in childbirth, again, largely preventable. More than 750,000 children die a year of measles. 1.6 million people die every year from tuberculosis.
okay, so this is a really cool resource for you guys called worldmapper.org. It's basically so you can pick from pretty much hundreds and hundreds and hundreds of statistics, and it'll morph a map of the U.S. Based on those statistics. So this is a map morphed based on childhood mortality. So you can see that like Sub-Saharan Africa, India, and certain parts of the world are just really, really bulging and huge, whereas if you look at most of the Western world, like Europe and North America, it's very, very small. So just to give you guys a quick idea of what kind of disparities, I know you guys mostly know this, but just to visually see it, if you compare like this childhood mortality map to the worldwide wealth distribution, it's almost opposite. So you can see that the opposite regions are really, really small, whereas these regions are bulging. We're going to send out a link after the meeting about worldmapper.org, and you can just go through, and it's a good way to kind of get a better grasp of what's going on in the world, because you can compare so many different things, and it's really easy to see exactly what's going on a large scale throughout the world. So
you can see like specific diseases, for example, AIDS, and then you can see again AIDS and physicians are almost completely opposite.
So the last thing that I really wanted to go over with you guys really quick is the Millennium Development Goals. Yeah, and not MGD, MDGs. But so basically there was a really big UN summit in New York this September, late September, and a lot of global leaders all came together to discuss where we are as a world community on trying to get rid of some of these disparities. The Millennium Development Goals were set in the year 2000 to be achieved by the year 2015, so we're 2/3 of the way through, and it was kind of a stopping point to step back and see where we are, see what kind of progress we've made, and where we need to really increase our resources and concentrate on getting rid of some of these disparities. So,
and just so you guys know, a lot of these were the baseline is 1990, so it's from 1990 to 2015. So if they say like a percentage, like reduced hunger by, I think it's 40%. There's like specific percentages they're saying based on the 1990 base.
Right, so we'll publish this document so you guys can go through and look more specifically. We don't really have time, unfortunately, in this meeting. But just to go through some of the major goals, and we'll just look at what the major goals are for what we're trying to concentrate on. Goals 1, 2, and 3 were eradicating extreme poverty and hunger, achieving universal primary education, and promoting gender equality and empowering women. If you guys got a chance to look at that Obama speech that was given during this summit, one of the really interesting topics that was covered was just local infrastructure and local cooperation, and that's something that GlobalMed really focuses on, just on getting the local cooperation, just like we were up here talking about earlier, going in with the nurses and not, being an outside, white funding sources just coming in with all this money and trying to take control themselves. Building infrastructure is very, very important. For example, if you don't have electricity or roads that are built by the community, then how is a child going to get to school? How is a child going to go to a school and learn if there's no electricity there, if there are no roads for them to get there? So just one thing we really want to highlight to achieving these goals is it's not just all these outside funding sources throwing in all this money to just magically make everything appear. It's local cooperation is really, really important to achieving these goals. And we don't have time to go through them specifically, but the red areas that are under these different regions are basically areas that have no progress, or actually negative progress towards achieving these goals. The green areas are the only areas that are on the right track to achieving these goals by 2015.
And there's very specific things that most of the World Health Organization, they have these determinants they use to see if someone's achieving these goals. So for example, improving maternal health, it would be something like, is there a doctor or a midwife at the labor? Is the woman getting to a hospital on time? So they have all these very specific things, and if these things are being met within certain numbers of women, then they say they're on track to receiving them. Kind of historically, these goal 4 and 5 are the ones that are having the most trouble being met. And I think in these last 5 years that we have, number 5 especially is really being worked on right now. So
yeah, and it's also important to realize that these goals don't only apply to to developing countries. These goals are put forth or applied to all countries everywhere in the world. Most of them are based off percentages, and most of them are based off of improving on the current whatever the current status is. So there are some developed countries that are actually moving backwards too. That maybe they started in 1990 when these statistics were taken, they were in much better shape than a lot of the developing countries, but still moving backwards is something that we need to get away from, and we need everyone to be focusing on moving towards improving all these goals. So yeah, that's most of the last two are environmental sustainability and developing a global partnership for development. But there's a lot of stuff coming out about these goals right now, just because it is at such a important position in 2010 to try and get there by 2015. There's a lot of stuff in the news coming out just after the summit, so just keep your eye out. And anything else?
Also keep in mind that these are very some of this data is a little bit skewed. A lot of these things are really hard. It's just as hard to categorize a country in terms of where they are on track as it is to actually get them on track towards improvement. So for example, something like the maternal health again, a lot of these things, if a mother dies in childbirth, if she dies, I think it's up to 6 months after she delivers, she dies, and it's most likely due to her pregnancy in some way. But that means someone has to actually say on a piece of paper she died because of her pregnancy, and not just attribute it to something else. And so a lot of times these things are underrepresented or not really realistic. So it's just as hard to categorize them as it is to solve them. And already they're talking about what they're going to do once we hit 2015. It's not we're just going to give up and say, okay, we're successful, we weren't successful. There's going to be new goals and new funding. So stay tuned for that.
That's it for us. Do you